One of the most common things that patients actually come in complaining to me about are tired, puffy appearing eyes. And it's actually one of the first things that people notice about you. And so there's a whole range of treatments for this problem actually. And they range from really non-invasive, so just using a great eye cream regularly, to something a little more invasive like an eye peel, which we can use around the under eye area, commonly helps with dark circles as well. Injectables for the tear trough area, which is the area under the eye as well, really help. And then we get into slightly more invasive options like laser resurfacing, particularly the lower eyelid area, and then surgical procedures such as an upper and or lower eye lift. And so an upper and a lower eye lift are actually designed to treat a couple of problems. So one of the things that happens as we age is the brows start to sag and we get extra skin of the upper eyelid. So sometimes this actually needs to be combined with a brow lift to actually elevate the brow. And then the other thing we do is we actually remove the extra skin of the upper eyelid. We remove some of the fat that's pouching out of that upper eyelid to lend to that bulging appearance. And we do the same thing on the lower eyelid, but on the lower eyelid, there's often not that much extra skin, but often a lot of bulging or herniating fat in that area, which can really contribute to puffiness. And so that can actually even be removed with an incision within the lower eyelid so that there's no scar whatsoever. And I often like to combine that with laser resurfacing of the lower eyelid for skin tightening. And one of my favorite things about doing an eye lift procedure, or really any kind of eye rejuvenating procedure, is that it's so subtle. And people don't really know that you've had anything done. They will often just say, you know, you look like you got some rest. Did you go on vacation? Which is, I think, great and just speaks to a really natural result.